All right, so today we begin chapter 10, which is patient administration considerations. In this chapter, we will be going over the following, which include discussing the patient education and a variety of therapies, common types of intravenous therapy, as well as the delivery of supplies. By the end of this chapter, you should be able to list several types of infusion pumps, also be able to list some examples of the types of medication therapy for which they are used, because based on what the medication is, whether it's antifungal or anti-infective, there are different infusion pumps that's supposed to be used. And you should also be able to list the technician responsibilities in infusion therapy in a home healthcare or a long-term care environment. And the abbreviation for long-term care is LTC. So now that I've gone over the objectives of what we'll be learning in this chapter, let's kind of go ahead and get into an introduction. So what happens uh, with the preparations and where they occur? So we know that there are different places, and those places are hospitals, home health agencies, as well as doctors' offices. Now, all of the clean rooms must be following the guidelines of the USP 797, which has to do with um, sterile compounding. We've learned over the past few weeks that there are different guidelines when it comes to compounding. So you have non-sterile compounding, which is USP 795, sterile compounding being USP 797, and then you have hazardous compounding, which represents the guidelines from USP 800. So anytime IVs are prepared, aseptic technique procedures must always be followed. So now that I've kind of gone over a mini introduction in regards to how preparations occur and the guidelines that's supposed to be followed when sterile compounding is happening, we're next going to learn about some patient education when administering the IV therapy. So it's always important that when IV therapy is administered, that we always ensure the patient's safety. And this is always going to be a factor regardless of the setting where it's being delivered, whether it's a hospital setting or a home agents or home health or even in the doctor's office. Patient safety should always be taken into consideration. So when you are speaking to the patient, when it comes to the IV therapy, is important information that the patient should be informed about, and that's going to include the therapy, the equipment that's being used, and also what to look for to ensure that the medications are stable and stored properly. So when it comes to the equipment that's being used, we'll be getting into that in regards to things like catheters and also infusion pumps as we continue in this chapter. So now that we've gone over a little bit of the patient education and understanding what the patient should be informed about, we're next going to learn about the different routes of administration that should always be taken into effect. And we're going to learn about the infusion and the equipment that's used. So when it's dealing with patient safety, we always want to make sure that we are following the patient rights. And what are those rights? You want to make sure you have the right patient, the right medication, the right strength, the right route, and the right time. So when it comes to checking to make sure you have the right patient, you're going to check and identify the information when interpreting an order. There are some times where patients may even have the same name, and the way that you can identify the correct patient might be looking at their date of birth, or you might sometimes come up with the case where a person may have the same name and the same date of birth. Another way of making sure you have the right person is looking at the profile and checking, perhaps the address. Also, allergy information is important. So you want to make sure that you're choosing the right patient when you're selecting um, the patient from the profile. You want to make sure that you have the right medication, and this is important because there are some medications that sound alike and look alike. So you want to check the order for accuracy and completeness. If you are unsure of something, check with another technician, or you can check with your pharmacist. But definitely, when in doubt, don't. So you always check. So another way of checking patient safety is making sure it's the right strength of the medication. 5 milligrams might look familiar to 50 milligrams, or there's a difference between 5 milligrams and 5 micrograms. So you always want to make sure that you're choosing the correct strength. So you'll check the order for the correct dosage or the strength, and make sure that the label is accurate. Now, when it comes to checking to make sure it's the right route, you're going to look at the directions based on what the prescriber has ordered. So we know that there are different routes. Something can be taken orally, something can be taken intravenously, or should I say parenterally, if it's something that's going to be injected. Something can also be taken topically, meaning it's going to be applied to the skin, and something can also be taken through the transmucosal, which means it's something that's going across the mucous membrane, which could be eardrops, eye drops, nasal sprays. So it's always important to make sure the right route is identified, and you can check a reference for the appropriate route. So that's why we have different references in the pharmacy, so we can make sure if a medication comes in a certain dosage form, and then also the appropriate route that the patient should be having it. Lastly is making sure that the person is going to have it at the right time. And so the right time can be identified as verifying the directions for the proper intervals for infusion. So if a person is supposed to have something at 2 a.m. or 2 p.m., sometimes things are written in military time, known as universal time. So it's always important to make sure the patient's safety is always a priority. So making sure right patient, right medication, right strength, right route, and right time. So now that we've gone over some of the patient rights when it comes to patient safety, we're next going to talk about the home health. So with patient education, that should begin before a hospital discharge, and it's usually the nurses or even the doctors that's going to give the patient education to the patient. Some of the things that might be provided to the patient if they're supposed to have, home health services would be an insertion of an IV catheter. They might have a PICC line or other implantable devices. Now with the PICC, PICC, that is abbreviated as a peripheral central catheter. So that's basically what that represents. So a peripheral is inserted. The PICC, in regards to that, you have peripherally inserted central venous catheter. And so with that particular catheter, it can deliver all different types of therapy. And they have like tiny tubes that's typically used for 72 hours. So if a person needed that for, say, a 3-day supply, that's something that they would use. Now, long-term therapy might require weeks, months, or even years. And then there are some special catheters that's designed to be inserted in the chest wall near the heart, which is what that's used for. Now, with the peripheral central catheters, it's important that patients are educated on the signs of infiltration or phlebitis, which is going to be basically inflammation around the vein area. And so the way that a patient could be educated on this would, be to check for, solution leaks into the surrounding tissues, because a person might experience some swelling or some redness or even some pain. So the IV site must be rotated to avoid continuing any type of infection or something that could lead to more inflammation. Now, when a peripheral central catheter is being used, they can flush the line as needed by using a SASH method. And with the SASH method, SASH, that is an abbreviation for a saline flush. A for administer the medication. The other S is for then they should enter the sodium chloride flush. And then H, they're going to have an heparin lock flush. So they can flush the line as needed using the SASH method. So the first flush would be saline. That's just going to be just water. And then, well, sterile, of course, but 0.9% saline flush. And then they would administer the medication, and then they would flush it with normal saline, which is the 0.9% sodium chloride, and then flush with the heparin lock. So this is an example of what a peripheral PICC line. I'll say that as the abbreviation. So picture A represents the PICC line, and then picture B represents the central line with a Mediport. And so you'll see how that would be, what that looks like up close. And so when it comes to patient education, it's important that the patient, that the person who's inserting the catheters always use, proper hygiene, hand washing, and then they would set up the pump with the medication. And then if in case of any problems that should arise, they always usually know how to troubleshoot the problems, and they'll have, like a 24-hour emergency numbers in the event if something's happening. So they'll have that information available to them and handy. Now with the supply delivery, it should be timely and it should be complete. And then all of the items should have the storage requirements on there to check for the temperature, and if something changes, because that could affect the stability of the sterile preparation. Now, if something's refrigerated, those items should be shipped in coolers. Now, with chemotherapy items, those would be shipped in like protective containers. So something that might have like the biohazard sign on it so that a person would know. And then the service should always include like a pickup of unused items. So just letting you know about what happens when some supplies are delivered. Now, when it comes to the different types of IV therapy, one of the different types of IV therapy is chemotherapy infusion. And so patients who are receiving chemotherapy infusions, that is delivered through an intra-arterial route. And so they're going to have hepatic artery for colorectal cancer. They have the celiac artery for liver cancer, and then they have the carotid artery for head, neck, and brain tumors. So any type of chemotherapy infusion is going to be delivered through the intra-arterial route. Now, continuing learning about different types of IV therapy, you also have where people receive pain management. And so an example of pain management would be them receiving a parenteral opioid, better known as an example of morphine. And so with morphine, that's a controlled substance. And so with parenteral opioids, which all opioids are controlled substances, the pain management can be given as a continuous IV, or it can be like a intermittent infusion. Now with parenteral opioids, they're commonly seen for hospice patients. When hospice patients are at the stage of their life is ending, sometimes people can be in pain, and so it's commonly used for hospice patients so they can be at least as comfortable as possible during that transition. Now with pain management, they are administered using a pump in which a patient can press a button to receive a dose of narcotics. I usually give examples of that. For example, if someone had maybe an accident or something and they're in very severe pain and they were giving uh, opioids through the parenteral and it's IV. They can like push a button, which is often seen like on a patient control analgesia pump. And so they can choose, they can't choose the amount that they're given because that's already calibrated, but they can at least click the button and then that dose would come to the patient. But there is a specific way how that dose is going to be given because they can't just keep pushing the button and then the drug can keep coming. So they can push the button to receive the drug, but it's already going to be calibrated. Now, when a person does receive a parenteral opioid, it can be pre-programmed in the pharmacy according to the physician's order. So as we talked about the pain management and the chemotherapy infusion, these are different types of IV therapy. Now, other types of IV therapy can include anti-infectives, and with anti-infectives, infective can also be given at home, not just in a hospital or a home setting. Um, so it should include labs that monitors the patient's blood level to avoid toxicity. Those anti-infective medications are given at a specific interval, and they're typically mixed as piggybacks. So you might recall when we started learning about different volumes of IV bags, you have small volume parenterals. Those are commonly known as piggybacks because they can have any less than 250 milliliters, and they can also be joined to a already standing IV order. So if a person is already receiving, say, sodium chloride, which is normal saline, 0.9%, let's say they're receiving that a liter, let's say they're receiving that over a 24-hour period. If a person has some type of infection, uh, they might be given a 250 milliliter IV bag that can be infused over a certain number of hours that can go along with the already existing IV bag that they're receiving. So with anti-infectives, they can be given using computerized ambulatory pumps and also be given using syringe pumps. So now that we've talked about the IV therapy for anti-infectives, let's next talk about the IV therapy for antifungals and antivirals. Now, with the antifungal and the antiviral medications, these can be administered at home using a volumetric infusion pump. And so these deliver a measured amount and they can also be programmed accordingly. So now that we've talked about the different types of IV therapy, let's next learn about the investigational drugs. And so the investigational drugs are drugs that are not yet approved by the FDA, but they are in clinical trials. So the key point guidelines for those IV therapy would be a person making sure they're eligible to receive the investigational drug. They can also be monitored for adverse effects. As we know, when medications are approved by the FDA, all of them have to have um, a list of what side effects may occur. And then that's why if a person is on an investigational drug, because they're going through the clinical trials, they're going to be monitoring them to see what are some adverse effects that they might be having. That's why also documentation is important, and then also the disposal of the drug is also important because it's not FDA approved, not yet, but it's in clinical trials. So now that we've completed talking about the types of IV therapy, we'll next talk about the different types of infusion pumps. So we learned with antiviral and antifungals, one of the pumps that would be used would be a volumetric pump. And so the volumetric pump works by calculating the volume that's delivered by measuring the volume that's displaced in the reservoir. So there is special tubing that's required, and it should be calibrated in milliliter per hour. So that would represent the flow rate. The entire IV bag is going to run over a certain number of hours, and based on what that patient is receiving, each hour is going to represent the flow rate. Now, volumetric pumps are used for high potency drugs because they are very accurate. So just using that as an example when it comes to the different types of infusion pump. So this is an example of an infusion pump, which can be calibrated. This is an example of the volumetric pump. It can be calibrated, it can be timed. It's going to exactly give the patient the exact amount of what it needs. And so the volumetric pumps, again, calculate the volume delivered by measuring the volume that's displaced in the reservoir. So now that we've talked about the volumetric pump, we'll next talk about the peristaltic pump. Now with the peristaltic pump, those move the fluid by intermittently squeezing the IV tubing. Now with these types of pumps, it's primarily used for enteral feedings, and they are also calibrated in milliliters per hour. So now that we've talked about the peristaltic pump, we'll next learn about the syringe pump. Now with the syringe pump, the piston-driven infusion pump, that's also what it has, and it's critical for small doses of high potency drugs. Now the syringes are actually prepared in the pharmacy, so it can actually, the medicine is actually filled in the syringe in the pharmacy, and then it can be administered in like a small volume parenteral, better known as a SVP. Now with the syringe pump, it can be administered in milligram per kilogram per minute or microgram per minute, and it also can be administered in milliliter per hour. So different ways how the syringe pump can be given to a patient, but it's most frequently used for antibiotics, and an SVP, which would be also known as a piggyback. So as we continue learning about infusion pumps, we'll also learn about the PCA pump. PCA standing for patient controlled analgesia. And so with the PCA pump, it's used for pain management at home, or it could be used in a hospital setting. The PCA works by delivering medication through IV, subcutaneous, or epidural routes. The PCA is also programmed to deliver a set amount of drugs at certain intervals. So certain intervals could be something that's going to be given every 8 hours, which is going to represent 3 times a day. Now, when it comes to the PCA pump, you have a bolus dose or a demand dose that can also be programmed for breakthrough pain. And then they also have a set amount that's determined by the physician that could be delivered by pushing a button where there is an additional pain felt by the patient. So that's what I was referring to earlier when I discussed that there are some patient control analgesia where they can also, push the button so that the medicine can come to them. But again, that's programmed, so they just can't keep getting the drug. They'll be able to get a dosing of the drug when they feel a certain pain, and then they can get it at another interval. So now that we've talked about the infusion pumps, when it comes to the PCA, let's talk about the ambulatory pumps. So ambulatory pumps are lightweight. They're also battery operated, and they allow the patient to resume a normal life because they weigh less than 6 pounds. Now with the ambulatory pumps, those can be used to deliver the most infusion therapies. And even when it comes to certain pumps, like for example, the PCA, there are some specific settings or modes that can be programmed before the pump even reaches the patient. So even though the patient is pushing a button, there's a special key or a locking device on the PCA. So now that we've completed talking about the infusion pumps, we'll next talk about some important documentation. Now, according to the FDA, Safe Medical Devices Act of 1990, all medical devices must be tracked. So this includes infusion pumps, and with these devices, the pharmacy must know the location of pumps at all times. And the documentation that's being taken on the devices is going to include a log, the dates of service, as well as the serial numbers. And so if something needs to be recalled, and they need to actually pull a specific device from being used, they can be able to do that because their information is documented. Now, when it comes to requirements, TJC, which stands for the Joint Commission, they require that preventative maintenance is done once or twice yearly, or at least according to the manufacturer's recommendation. So that's why there should always be a log for the devices so that there is a tracking of when it was last checked and approximately when the next check should happen. When it comes to cleaning, the cleaning is performed after each patient use. And so this is going to help by making sure that no infections are being passed and that it should be maintained. So in going with more information when it comes to the documentation, all of the documentation should be accurate. It should be timely, so that means it should not be outdated. So if something was supposed to be logged today, it should happen today and not next week. And it also should be complete. So there should be no blanks left on the form. Now, with each entry, the document should be signed, it should be dated, it should be documented every conversation, meaning when it was used, what day, what time, the follow-up visits, and even the instructions. So these are just some of the examples of the documentation. Now, for when a technician prepares it, there are some responsibilities of the device, and some of the responsibilities include the proper labeling, make sure it's transported correctly, gathering the flushes that's needed, and then also any other supplies that might be needed as well. Now, based on the supplies, those do depend on a few different things. It's going to depend on the infusion device that's being used. Remember, certain medications require different types of pumps. Different supplies is going to include the types of bags. Sometimes they just may need an IV push, or they might need an IV bag. So it's important to know what supplies to use based on the route of administration. They also need to know the type of vascular device is being used. For example, is it going to be a PICC line, or are they going to use a central line? And they also need to know the type of drug therapy. Is a anti-infective being administered? Is a antiviral being administered? Is a patient control analgesia being administered? So it just depends, and based on the physician's orders, the technician will be able to know which device to give, which pump to include, and also know the other supplies that's needed. Now, with pumps, those must be calibrated and they must be maintained, which that is set according to the manufacturer's instructions. Now, when it comes to delivery tickets, those should reflect all supplies delivered. And the reason why is because it's essential to accurate billing, and it's also important for the quality patient care. So all of these things should be taken into account. So now that we've talked about the documentation, with the supplies, there are some different supplies that should be sent home when it comes to infusion therapy. So when it comes to if supplies are being sent home, the patient needs to be sent the IV start kit, the CVC kits, which is going to include the central venous kits, such as the PICC lines. Patient's going to receive some IV tubing, and then they can also receive extension tubing, which is basically extension sets. And then they're also going to receive an IV filter. So all of this needs to be documented on what was also sent. Now, continuing with some supplies that's sent to the home, they're going to also have some injection caps, and those actually go on the end of the catheter. They're also going to have some syringes and some needles to flush the line with. So if something needs to have an IV push, they can actually have that too. They're also going to have an IV pole, and this is what the um, bags would hang on, and those are for pumps that are non-ambulatory. The patient's also going to receive some alcohol pads and also have some infectious waste bags and sharps containers for needles. And then they also should have some tape, and that's usually for the dressing changes. Some other supplies that's going to be sent for home infusion therapy is going to include gloves, some batteries, the chemotherapy spill kit if it's needed, because in the event if some chemotherapy is spilled, there are proper procedures that should be taken into account when that is cleaned up. They would have some heparin vials for those flushes, and then they would also have some normal saline vials for those flushes, because what if the person has to do a SASH method, SASH? Those would be needed. Now, when it comes to the technician's role in home health care, the technician's role is much different than from working in a hospital. So the technician would be gathering all of the home infusion equipment and the supplies. And then it's also important that the technician maintains the progress notes. And then the technician could assist with the billing third-party administration, letting the insurance company know what items were used, as well as the devices that has been used. And when it comes to the quality of patient care, there's always the cleaning, the tracking, and also maintaining the infusion devices, uh, performing quality control checks on the various equipment, which is why documentation is so important. So we can always keep a record of when um, the device was used, and who cleaned it last. And then also, it's important when it comes to the quality of the patient care that communication with the family and other healthcare team members is essential. And this is going to complete chapter 10 of patient administration considerations.